The new mental health service in York has been commissioned by the Vale of York CCG to cover 9 surgeries. There's 3 centralised surgeries that we don't cover as of yet, but we'd hope to expand to them at some point. The whole mental health services need restructuring. Mental health should be within the community. It should be accessible. It should start at a low level and go to a high level, and it should be, you should see the person that you need to. It was set up because there's a need identified that mental health affected about 30% of GP appointments. So that, you know, if you cover all the surgeries we cover, that's thousands of appointments a year that are mental health focused. So it was identified that we needed a mental health team in primary care that was easily accessible to the community and that could offer, I suppose, some form of therapy. It's quite a diverse programme that we are setting up. The difference being to other services, certainly the Access to Mental Wellbeing team, which is run by the Tube service, is that they deal with a moderate to severe mental health. The majority of mental health is mild to moderate. So unless you access third sector such as Mind, who do a great job, and other charities and groups, a lot of people don't get the support they need. And a lot of patients with the stigma of mental health feel comfortable in the setting of a GP surgery, so that's why we identified that we should be based in GP surgeries. People acknowledge these days more that they have mental health difficulties. You know, the stigma's reducing, so people are accessing services a lot faster than they used to. In the older days, people accessed services when, I suppose, when it was at breaking point. The team naming came from the idea that the public should be involved because it's a team that's going to support the community. So what better way to do it than to allow the team to be named by the community? What the public can do, we've identified 8 names that we think are appropriate for the service, and it's for the public to pick that name. There is a need for primary care mental health. This is the start. It's not going to be the end.